Order. Hello, good evening, good afternoon, good morning to wherever, which part of the world you are. As I'm not sure who all have joined and from where they are uh, joined me, which part of the world. So today we are going to talk about the second in the series of the lecture we have planned with the woodpecker, war of wavelength, which laser to buy. Why we are talking about wavelength? Now, something I want to show you. Okay, this is my setup. I work. I've got 3 clinics, and I do lot of lasers. You can see I have a hard tissue, soft tissue lasers, and I've worked with almost all the wavelength currently available Uh, we will be sharing about those wavelength later on also. So what is the importance of wavelength? Long back, I've been asked, like, I'm working with the laser since 2008 or 9, and then I procured my first laser during that time. It was a, soft tissue laser, diode laser, and I started lecturing from 2010 onwards. And often in my lectures, I used to ask, sir, which company laser is best? So no, all laser works, all laser cuts. It depends upon how you use, which wavelength you want. It depends total upon the uses, how you want to use the laser. So I wrote an article. This article was published in one of the journal, in Indian journal, in the year of 2014. And the confusion is not with the heart tissue laser, confusion is not with the NDR, confusion is not with the carbon dioxide laser, confusion is always with the diode laser, because they have got so many wavelengths, which wavelength we need to buy. So this article was published in year 2014. That time we had 810 nanometer wavelength, 940 nanometer wavelength, 1064 nanometer wavelength, and 980 nanometer of wavelength. This is my original article. Why I'm again presenting this lecture in 2022? Because nowadays we have got more lasers, and so like it say, more variety, more confusion. So you need to be aware of what your laser can do. So let's go briefly. Let's go into the detail about different aspect of wavelengths and all. What is the importance of wavelength? And maybe initial 10-15, I will quickly go through the currently available all wavelengths in the laser dentistry, and then we will go focus more on to diode laser or the soft tissue laser. What is the topic, like which wavelength is the best, right? So this is a wave. We all know what is wave exactly. So this is the wave. The picture is very clear. I'll skip this part. So, Webster's dictionary defines a wave as a disturbance or variation that transfers energy progressively from point to point in a medium, and that may take the form of an elastic deformation or of a variation of pressure, electric or magnetic intensity, electrical potential, or temperature. So, something like this. Wavelength is the distance in the line of advances of a wave from one point to the next point of corresponding phase. So if you see this diagram or this picture, wave is a form of disturbance which travels onwards due to repeated periodic motion of the medium particles, and energy is transformed during this wave motions. So this is like something about what is wave and what is wavelength. Another little bit of physics diagram which is very popular, I want to show you here. There are the certain things we need to know. Amplitude, it is a measurement of the relative energy of the wave. And then the next is wavelength. It is measurement of the amount of distance between the same points on a repeated waveform. So if I go through this diagram, you can see here the height which a wave attains is known as amplitude, whereas the distance where two exactly distance between the two waves is the wavelength, what it travels. So this is wave and this is wavelength. This wave travels at the speed of light when we are talking about laser dentistry. So the wave travels at the speed of light in the laser dentistry. Why are we discussing physics in dentistry? Often we have been asked this also, because we are discussing laser, and one of the most important property of laser light is unique wavelength. Uh, those who joined me in the last webinar, we have discussed little bit about the physics. I'll go very briefly about again what exactly is the wavelength. Now you need to know, I hope you all can remember, the laser light is peculiar. They have a unique wavelength. So before that, let's discuss little bit in detail about electromagnetic spectrum of wavelength. So there are invisible, ionizing radiations, visible to human, invisible infrared, and far infrared. So I'll simplify it. We all know human eye can see only between 400 nanometer to 700 nanometer wavelength. They are visible color and known as VIBGYOR. And you can see also the 400 is a violet, and if you go toward the higher wavelength towards 700, it is red color. So anything below 400 is ultraviolet, anything above 700 is infrared, right? So, and beside this, there are X-rays and there are other gamma rays and all those things are there. So lasers are also unique. Not unlike the normal light, which is made up of multiple colors, or your daylight, or the light which we are using right now, I'm using, they are made up of different color and have got a broad spectrum. These laser has got a very peculiar wavelength, and whatever lasers we are using, even in dentistry or of the dentistry, industrial use, army use, defense use, or medicinal use, they have medicinal use, they have a particular wavelength. So let's go to the little bit of briefly introduction of the wavelength which are currently available in laser dentistry. Like I just told, near infrared, mid infrared, and far infrared. So dental lasers are either in the range of visible wavelength, that is between 400 to 700 nanometer, or they are near infrared, mid infrared, and far infrared. Ultraviolet lasers are there, the eximers, but they are not used in dentistry. They are used in ophthalmology or other medicinal sites and all. But in dentistry, we have lasers only, either they are in the visible wavelength, or they are into near infrared, mid infrared, and far infrared. What are those lasers again? KTP, Dignodent, diode lasers, diode lasers, diode lasers, diode lasers, more diode laser, and then Nd:YAG laser, which is 1064 nanometer, or soft tissue laser. Then again a diode laser, then Nd:YAG laser, which is 1340 nanometer. We have erbium family, they are hard tissue lasers, and we have got erbium CO2 lasers. Now CO2 laser also we have two unique. I'll briefly go into the detail of those wavelengths and all, and then we'll come back to our main topic, which is uh, importance of wavelength in diode dental lasers, right? So the family tree of lasers in dentistry are, you start with from the CO2, which was the first laser which was introduced in dentistry here. If you can recall my last webinar in 65, uh, it was a dermatologist used on his dentist brother carbon dioxide lasers. Then Nd:YAG was the first laser which was FDA approved, which got FDA approved in the year late 90s, late 80s, late 80s. It was introduced in laser dentistry, and then erbium laser came into the picture year 95, 96. Then diode laser came, and then erbium chromium YSGG, then KTP, and of lately many diode lasers. So most of the research work currently going on in the diode laser, in the laser dentistry are the diode lasers, right? So how it goes? Classification we have discussed last time. Just for revision point, we have got hard tissue lasers, and we have got soft tissue laser, and then we have got non-surgical lasers. Erbium family and CO2 are the mainly hard tissue lasers. So what wavelength they have? They have basically, let's discuss hard tissue laser first. So hard tissue laser, traditionally they are erbium family. Only BioLase is the company which is making erbium chromium YSGG. Nanometer specific is 2780 nanometer, whereas rest all the commercially available hard tissue lasers are erbium YAG lasers. Whether you buy from Photona, or you buy from Light Medics, or you buy from Dr. Smile, they all are erbium YAG family. This erbium chromium YSGG is peculiar to BioLase. Have worked with both the company, and I've worked with both the lasers. I've got two small videos to show you the demonstration, the use of those lasers, hard tissue lasers. So you can see here we have used laser for removal of veneer. I'll forward it a little bit. So this is how we use, right? So erbium family is the basically they are the traditional heart tissue lasers. Of lately, a few years back, Solia is the company which is using an isotropic CO2 laser that is operates at wavelength of 9,300 nanometer rather than the 10,600 nanometer wavelength, and utilizes by native carbon dioxide lasers. So Solia is the another heart tissue laser, and very recently they have come into the what you call in the industry. They are excellent device. I have worked on these device also. I mean, I've attended some workshop and demo when I was in USA. Unfortunately, they are not available in this part of the world yet. So this is something about heart tissue laser, and we are not going to detail because heart tissue lasers are very specific. So we are not going into the detail of these lasers much, as those who can access these heart tissue laser, they are not bothered about the wavelength and all. What is important for us is soft tissue lasers, right? So next is comes is the wavelength is 1064, that is ND-YAG laser. As you all can remember, this is the first wavelength which was introduced, and FDA approved in dentistry. It was in 1989. So you can see on the left side of the screen, if I can show you with the pointer, this is a Periolase. It is Periolase 7. It is owned by Millennium Lasers. And whereas this particular laser is a dedicated ND-YAG laser. This particular laser is a dedicated ND-YAG laser, and uh, it is one of the finest ND-YAG laser, and they have got a protocol also registered LANAP. Whereas if you see on my screen right hand side, this is a photona laser. This is a basically dual wavelength laser, where you can notice the one particular handpiece is there erbium, used for erbium, whereas small handpieces are there, they are basically ND-YAG laser. So this photona 80 comes with, or photona dual comes with the 2 wavelength or 3 wavelength, whereas you can see the Periolase, it is dedicated to ND-YAG lasers only, right? So what are the use? I mean, soft tissue surgery, bare fiber delivery, free running pulse, high peak power, removal of separated. Okay, this is something about the ND-YAG laser. This is another wavelength, which is again not very popular. It's a soft tissue laser. Very futuristic design. If you notice here, Loki is the company which is marketing. It's a French company, and they have a very limited market and very limited users, but a very futuristic design. So advantage of this particular laser was they produce very high heat for a fraction of second. So if you notice the use of this particular laser, besides soft tissue surgery, bare fiber delivery, they have advantage of removal of separated endophiles. So what I mean by removal of separated endophiles, the concept was you create a very high temperature for fraction of milli of seconds, so that the file which is fractured in the canal, it melts, and then they get stuck to the delivery portion of the laser. So when they melt within fraction of second, they cool down, metal cools down, and they get stick to the your delivery system, and you can pull with the using by melting that particular portion. Research is going on that particular research work. A lot of research work is going on this particular method for removal of file. And like I told, ND-YAG looks very futuristic design, but very high price. They are still, and again, they are not available in this part of the world. So this is review of ND-YAG, and CO2. Besides this, we also have CO2 soft tissue laser. Now, when we talk about CO2 soft tissue laser, you need to understand few things. They like I just mentioned, we have Solia, which is a hard tissue laser, and we have the traditional soft tissue lasers. They are carbon dioxide, 10,600 nanometer wavelength. They are one of the finest cutting lasers. So if you have like let's say if you practice, you want to use laser just for the surgery point of view, they can be an excellent choice, but they are limited in use. I mean, the indications are limited compared to traditional diode lasers and all. So again, I can show you one frenectomy done by carbon dioxide laser. This case is courtesy of Dr. Donald Coluzi. He shared this case with me, and I'm thankful to him. So you notice here the frenectomy, it is immediate post-op, where we have used CO2 laser for freenectomy, and you can see charring, slight charring. We will discuss about this more in detail when we will talk about various wavelengths available in diode laser. So this is a CO2 laser, and this is a heating after 15 days or so. So CO2 lasers, VAR. So let's come back to the topic where we are today. VAR. Where is the VAR? So VAR is actually, it is in the diode laser where most of developments are happening. Right now, commercially, we have these wavelength in the market, they have their own advantages and disadvantages. So how many wavelengths are available right now in the market? You need to understand diode laser. We have got 810 nanometer, we have got 940 nanometer, we have got 980 nanometer, we have got 1064 nanometer, we have got 450 nanometer, we have got 650 to 670 nanometer, and we have got 655 nanometer wavelength. So briefly, I'll give you one example of each wavelength, what are commercial they are available. So for 810, most popular, one of the most popular laser of 810 nanometer is AMD laser Picasso light. They have two lasers, 810 nanometer. One is 2.5 watt and other goes up to 7 watt. What about other wavelength? I just discussed 940. Now again, if you remember, erbium chromium 𝐻𝐸𝐺 is heart tissue laser, which is patented, and it is patented to biolase only. And same way 940 this nanometer, like 810 nanometer. If we talk about 810 nanometer wavelength diode laser, there are other companies also, like 𝐼𝐸 is also making Odyssey is the one laser, and many other companies are making 810 nanometer diode laser. But 940 is strictly you can say patented to biolase. Only biolase is marketing this laser. So 940 nanometer is dedicated to biolase. Beside this, we have again got 980 nanometer. 980 nanometer, I have shown a picture of Lightmedics. It is an Italian company. Dr. Smile is also making 980 nanometer wavelength. Dr. Smile is making 810 nanometer wavelength also. Many more companies are making these wavelength, and we will be talking more into detail. Like I just told, except 940, the wavelength we are discussing, they are not like patented or they are dedicated to biolase. So other companies can also make those lasers. So this is one unique laser, 1064 nanometer. Technology for Medicine is the company which is making. 1064 is a unique wavelength because it is exactly the same wavelength of ND-YAG laser. So the idea behind introducing this particular laser is we get the same wavelength which can act as a ND-YAG laser. ND-YAG laser, I just mentioned a few minutes back, that ND-YAG laser is a laser which is used for the protocol LANAP, that is laser assisted new attachment procedure, and very popular and excellent protocol for treatment of periodontal diseases and all, right? So this is like 1064 nanometer. So these are the traditional wavelengths which were available till few years back, and like I told, many companies are there marketing these lasers. Of lately, in the recent year, a new wavelength has come, that is 450 nanometer. Why I'm talking about 450 nanometer? If you notice till now, whatever wavelength I've discussed, they are near or near infrared wavelength nanometer. Near infrared means they are above 700. So they were not visible to human eye, right? So all those diode laser, whether we are talking about 810, we are talking about 940, we are talking about 980, or we are talking about 1064, they were not visible to human eye. This is the first surgical dental laser which came into the market, and it is visible to human eye, and this is a blue color laser. So this particular is LX16 plus of introduced by Woodpecker. Again, other wavelengths since we are talking is 630 to 670 nanometer dental lasers. These are low level laser therapy lasers dedicated, and there is a company known as Thor. They are doing a lot of research work with this low level laser therapy, and these are the best laser for biostimulation or biomodulation. They are also known as healing laser, and they are red color laser. I will be talking more into the detail over next few slides about these particular wavelength. So just for illustration purpose, I have shown you here. This is a laser by a red color laser, which has got no surgical effect, but it has got therapeutical effect on the tissues, and they are known as repair or healing lasers also, right? So Thor, like I just mentioned, Thor is a company which is basically marketing, doing aggressive work in this particular stream of health care, right? So 650. And like I just told, another wavelength which I've mentioned available in the diode is 655 nanometer visible diode laser and Cavo diagonodent. So they are basically laser which are used for detection of caries. I'm not going into the much detail about this particular laser because they are not surgical laser, and again they are the only, Cavo is the only company which is currently marketing and selling this particular device, which is known as diagonodent, and they are used for laser detection, for caries detection, right? So come back to the topic where we are. This was like brief review on the available wavelength of lasers in dentistry. So these are some facts you need to understand. Light penetrates into skin, illustrating the depth to which wavelengths penetrate human skin. Red light is extinguished some 4 to 5 nanometer beneath the surface of the skin, whereas ultraviolet hardly penetrates at all, and blue barely 1 millimeter into the skin. So this particular is not like my statement. This effect I have taken from PubMed article, and you can see here effect of wavelength. The article is effect of wavelength and beam width on penetration in light tissues interacting using computational method. It was published in article in 2017, and it is open journal, Journal of Laser Medical Science. It is an open journal and accessible to all. Beside this, some more facts I want to discuss here. So this is also picture is taken from that article only. This particular picture is taken from that article only, and you notice UV has hardly any depth of penetration here, whereas as we go blue light, 440 or 450 nanometer, they can go up to 1 micron, 1 millimeter. Then green has got better. Then as you go to the color and infrared, near infrared, depth of penetration increasing. So common logic is depth of penetration as we go from UV to the visible wavelength to near infrared. The depth of penetration is increasing. But another fact which is important to know is also shared in this particular graph also. Like the penetration depth of light into skin increases with wavelength from UV to the visible light range before decreasing again in the infrared range in accordance with the selected optical properties. Why I'm talking about this here? So see this particular diagram, absorption characteristic, this particular diagram, which is taken from dental application of advanced lasers, published in 2004. It was published long back. So if you notice here, that time we had only diode lasers which were available in near infrared. Not even a single diode laser was available which was visible. So the article was published in 2004, and if you notice here, excuse me, ND-YAG has a depth of penetration 2 to 6 millimeter. Diode has depth of penetration 0.8 to 4 millimeter. Argon has depth of penetration 0.5 to 2 millimeter. Erbium very less, 0.005, and CO2 is 0.1 to 0.2. What is the clinical significance? ND-YAG is the same laser which is used for hair removal, very popular laser for hair removal. ND-YAG is also very popular for removal of tattoo, whereas diode has got different depth of penetration. Why? Because diode has a wavelength starting from 810 can go up to 1064. So what a simple understanding is, if I'm using a diode laser of 810 nanometer, the depth of penetration will be 0.8, whereas if I'm using a diode laser of 1064, which is exactly or near to the ND-YAG laser, depth of penetration can go up to 4 millimeter. So, whereas ND-YAG is used for removal of hair and tattoo and all, diode lasers are more active if you go layer by layer. Same way, if you notice here, erbium, even though we are not talking about erbium lasers here, but erbium is very less, 0.005. So they are used as a fractional laser for removal, chemical laser peeling for rejuvenation of skin and all. They are used erbium laser, where they remove very thin layer of skin from the top, right? So the significance of this particular diagram, again, justified by more research work. So let me go through those research work, then I can go to the clinical significance. So there are certain articles which I reviewed for this particular presentation, where this particular article, on my left hand side, if you notice here, they have checked the cutting efficiency of soft tissue laser using diode laser in the different wavelength, like from 400 nanometer to 1500 nanometer. They have used the cutting efficiency. Same way, disinfection of contaminated canals by different laser wavelength while perforating by performing root canal therapy. Here also, this particular author has reviewed the efficacy of different laser wavelength into the disinfection of canal. Again, this article, which is published in year 2021, Irani journal, it's a PubMed journal again, where they have used blue laser. They have reviewed use of blue and blue violet laser in dentistry, a narrative review. Again, another article which I have mentioned here is effect of bactericidal effect of diode laser on E. faecalis in human primary teeth. Why it is important, effect of diode laser here? Because E. faecalis is the commonest, or the what you call, is the bacteria which is present in the root canal. And when we are doing root canal disinfection, we need to see the do disinfection with a laser. We need to see the bactericidal effect of that particular wavelength. Right. Again, one more article I want to mention here is the where they have we check the quantum square pulse of the erbium dental laser, then effect of different wavelength of laser irradiation again on skin cells, and 450 nanometer again blue laser, a new help in oral surgery. This article, and also I have reviewed almost 30-40 articles on low level laser therapy, and I've mentioned this particular article here, which is a compilation of at least 30-40 article. It is available on Thor's website, where they have reviewed, I think, 40-50 articles just on the low level laser therapy. Same way, another article which I have reviewed is development in low level light therapy, and again, influence of external chromophore on cutting efficiency of 940 nanometer diode laser. So I reviewed almost all the wavelength available, their cutting efficiency, their disinfection efficiency, their effect on the different wavelength, what is and all. So what I get, what I want to show by these articles, all these articles are available with me, and they're also available online. So if any one of you want these articles, I will be more than happy to share with you. But what was my idea of reviewing of these articles? What was my idea? Now I wanted to discuss about the best wavelength. So what is the best wavelength which is, I mean, which can be used in dentistry? So what was my conclusion? Not one wavelength. See, if I talk about the this which wavelength is best, you need to understand not one wavelength can serve all the purpose. So there is no single wavelength which can serve all the purpose. So you have to use different, like particular wavelength may have a better cutting efficiency, but it may have got a lesser depth of penetration, or it may also one particular wavelength may be mild on the body. And what I mean by mild on the body, like when we talk about laser dentistry, we discuss it is a painless dentistry. You don't have to give anesthesia. So if I'm talking about a particular wavelength, let's say 810 nanometer, if I'm using for cutting purpose, 810 nanometer is, since depth of penetration is very less, so there will be hardly any pain when I'm using for the surgery. But then again, it may take more time for cutting the particular, if I'm doing a surgery, it may take more time. Also, it I may not get exactly the disinfection what I want. Depth of penetration is limited. So depth of penetration increases, like I've just mentioned, depth of penetration increases from red to near infrared, then again it decreases as we go mid and far infrared zone. Blue laser light has got better cutting efficiency compared to near infrared diode laser. These are again review which was there in uh, my review. Depth of penetration is better in ND-YAG or ND-YAP or near 1064 nanometer diode laser or 980 compared to 810 or 450. Same way, red lasers are best for low level laser therapy. So what I understood by this, you can see here, these are the four cutting same surgery by using different wavelengths here. And you see here, like diode, if I'm using, the cutting efficiency is something this, whereas ND-YAG, it is more less charring, whereas in CO2, which is here, it has got more charring. Erbium is similar to somewhat ND-YAG laser. So CO2, you can see more charring, so healing will be affected, whereas for ND-YAG, healing will be the best. Same thing happen if I'm using a laser which is similar to ND-YAG, the cutting efficiency. exactly, and this is healing after 15 days or so. So short wavelength laser interaction with soft tissue. You can see here more charring, less charring compared to CO2 laser, whereas ND-YAG has got again less charring. So CO2 produce more charring, and we don't want charring because charring is there. Then that means healing will be delayed. So lesser the charring, healing will be better. But then again, if you we are just talking about surgery, then CO2 is the best. No, again, so which laser is best for cutting? Like I just mentioned, no single wavelength serves the purpose. So if you go by the articles, you need to see these are the traditional wavelength of the laser which were available, and then I'll go into more detail. So let's see a small video where I've compiled different wavelength and different wavelength of infrared and near infrared laser devices. So this is 810 nanometer MD Picasso, my first laser. This is a 980 nanometer diode laser. And this is the 940 nanometer laser. So you can see, I mean, all laser was cutting. So where is the advantages or disadvantages? Let me show you the next slide. Compare blue laser with other wavelength. So let's compare the current laser, which is the current phenomena, blue laser with the other wavelength. So I have got here.
You will have the confidence to add this to your treatment options. To remove this fibroma, I'm using the gingivectomy preset and the 400 micron tip.
So here if you see,
wattage is 1 watt of average power. I have found that I rarely need to exceed 1.2 watts.
Here I've compared blue laser with the traditional 940 nanometer wavelength.
To use the least amount of power necessary to complete the procedure you are doing. To anesthetize the patient, I'm using a stronger topical anesthetic that is applied to the tissue for 1 minute. You need to initiate the tip before removing the lesion and have your system keep some tension in the tissue you are removing with the help of a heat step. I start at the base of the lesion, keeping the tip perpendicular to the tissue I am.
You can see the cutting efficiency.
Sweeping motion,
comparing side by side.
And right to left, watching the tissue separate. Try to keep the tip parallel to the top surface of the lip. After removing the fibroma, switch to the preset. Although there is
So it is clearly visible that when we compare these two wavelength, compared to these two, blue laser was much faster. Again, I want to show you this particular these comparison where I've used in one first case I've used a 980 nanometer wavelength, and other place I've used a blue laser. So you can see here. Let me go to the procedure. Both cases were done by me. And I want you to notice, whereas blue laser, very selective blanching. And I just mentioned also a few slides back, the depth of penetration for blue is less compared to the 980 wavelength. So collateral damage. So what is the advantage here? Not only I am able to remove melanin pigmentation, but also the collateral damage is less, which I can show you here. This is like, see, hardly any collateral damage compared to 980 nanometer wavelength. So obviously, when there is no collateral damage, because less depth of penetration, healing will be faster and better. So again, question comes: how about one laser with multiple wavelengths? So till few years back, it was a concept like nobody even thought of that we can get. Like I just told, not a single wavelength is sufficient for all the procedure. So the question comes like few years back, if somebody would have asked me, can we have a laser with all these wavelengths or 3, 4 wavelengths, something like that? So the simple answer, no, you must be joking. But it is possible now that we have got one diode laser which can have multiple wavelengths. So I want you to go through the detail of this particular laser. So Woodpecker, since I'm on the Woodpecker platform, they have got two dental laser in the market right now. They have a classic one, LX16, and they have advanced one, LX16 plus. LX16 has got two wavelengths, 650 nanometer and 976 nanometer, whereas LX16 plus has got three wavelengths, 450 nanometer, which is blue. It has got 650 nanometer, which is red visible laser dedicated to low level laser therapy. And they also have 976 to 980 nanometer, which is close to 980 nanometer. Now, why we need three wavelength? We'll go one by one. Advantage of LX16 plus compared to the traditional laser. If I'm using 450 nanometer for surgery, uh, this is the only wavelength. Blue laser is the only laser which can work in non-contact mode. I'm talking about diode laser. I'm not talking about CO2, or I'm not talking about Nd:YAG, or I'm not talking about RBM. They can work in non-contact mode, but in diode laser, if I'm talking about diode laser, 450 is the only wavelength, or blue laser is the only laser which can work in non-contact mode. What I mean by non-contact mode, if I'm using a traditional wavelength, like let's say 810, 940, 980, or 1064, I have to touch tissue for cutting. Whereas in non-contact mode means I can practically I'm not touching the tissue. I'm 1 millimeter, 0.5 to 1 or 1.5 millimeter away from the tissue. Still, I'm able to cut the tissue. So this is the one advantage. So you don't have to activate the tip. What I mean by activation, traditional laser, you need to use it you need to activate the tip by passing on carbon, passing on wine bottle cork or something like that, any object, so that they get some pigments get deposits, and then we can work for the cutting purpose. So we can realize a non-touch cutting consume less. What another advantage, since I'm not touching the tissue, I can use the tips more. These laser comes with the different type of tips, and you can autoclave and you can use it again and again. Can cut with the lower power, more efficient, there is less heat or power waste, and have a natural fluorescence providing clear vision. Again, they come in a package. So if you go to the Woodpecker complete package, they've got a dedicated low level laser therapy tip, they've got biostimulation tip, they've got healing tips, they've got bleaching tip also. Beside that, they've got surgical tips, they've got perio tips, and they have also got endo tips. So they come with a complete package, and if you're buying, everything comes in a box. You don't have to buy any attachment separately. All comes into the box. Now we have got three wavelengths here. So what are the advantages of other laser wavelength? So 980 wavelength. Let's talk about 980 wavelength. I'm discussing about the various articles we have gone through, as it got better depth of penetration compared to traditional 810 or 450 nanometer. It is excellent in area where deep penetration of laser light is required. Now, where all we need deep penetration of laser light. So what is the advantage, or why we should include 980 nanometer wavelength? Mind it, 980 nanometer is an excellent laser for surgery also. But here, if I'm buying a laser like LX16 plus, I would prefer using it other application, because for surgery, I would prefer using 450 nanometer wavelength, whereas 980 nanometer I will be using in root canal disinfection. Why? Because more depth of penetration, it can go deeper into the dental tubule, it can go deeper into the other area which lateral canals and all those things. So I have a video which I want you to see where I've used 980 nanometer for root canal disinfection. So how do? We remove it is after preparation of the root canal, and when canal is finally just prior to obturation, there are two ways. Either I can use in a dry canal, so here I have keep 1 millimeter short of working length, or I can use in wet canal. This is the motion how you are supposed to use. Circular motion up and down. And clinical procedure, like I just told, prepare the canal just prior to obturation. Flush with EDTA. It is important to flush with EDTA. Why? Because you need to remove smear layer, then only depth of penetration will work. So something like that. Final flush with EDTA, and then we pass laser into the canal. Since it is a wet canal, I've used hypochlorite here. Advantage of using hypochlorite, we get synergism. Means when I'm using laser with the conjugation of hypochlorite, hypochlorites get activated. It increases, laser increases the temperature of hypochlorite, so the temperature increases. So basically we are getting two effects. When I'm increasing the temperature, hypochlorite is also get activated. Also laser has its own disinfection properties. So this is the one use where I can use 980. Beside this, where else? There are numerous research and clinical case studies show that certain lasers adjunctively used with scaling and root planing can improve the effectiveness of periodontal therapy. We talk about millennium lasers, periolase. The wavelength is 1064. So why periolase is better than other lasers? Because depth of penetration is high, so it can go deep into the root canal. Deep into the periodontal pockets. So if you notice here in these slides, laser energy eliminates bacteria embedded in tissue within its range of contact and absorption. So if I'm using diode laser for periodontal disinfection or removal of periodontal pocket, 980 is a better wavelength compared to 450 or compared to 810 or compared to 940. So for periodontal disinfection, I can use this laser. Some studies I can mention here again. Some more studies where they have compared Nd:YAG laser for this, and those who want more detail can go and Google the top word LANAP, LANAP, laser assisted new attachment procedure, right? So again, effect of diode laser eradication on root surfaces. This is a protocol. So you can use it for periodontal disinfection in periodontal problem. So in perio, 980 has got, so we have discussed 980 role in root canal disinfection. We have used 980 for periodontal. Where else? Now this is another aspect which is upcoming and very demanding. So I took this article from, I just Google number of implant placed in 2019, and you can see like certain articles came. The number of implant placed, the current market was in the year 17 is 4590 million. But what is more interesting is to know that, excuse me again, sorry, dental implant market is going to reach USD 8.6 billion by year to 2026. So that means by year 2026, the implant market is going to be huge. What is more important for us? Why I'm discussing this in why I'm discussing implant in a laser webinar? You need to know that average implant failure rate, like the studies have shown that somewhere between 5 to 10% dental implant fails. Now, I'm not talking about or not discouraging about dental implants fail here, because it is a positive note that we have got a success rate of 90 to 95% in the implant, so which is very good odd in terms of dental and medical procedure. But the 5 to 10% implant which are getting failed, we need to understand why they are getting failed. So besides occlusal prosthetic part. The commonest part of implant failure of implant is peri-implantitis. So for peri-implantitis, again 980 is the one wavelength which is ideal. To treat peri-implantitis, there are very few protocols. So for peri-implantitis, either I can use microbrush. There are some companies, they are making microbrush which we are supposed to use in micromotor and go along to the implant side, infected side and all. Or we can use Teflon tip. You need to understand, normal ultrasonic tips are not advised because they may cause destruction of osseointegration. So we cannot use normal ultrasonic tip. What we are supposed to use Teflon or tough type of ultrasonic tip, which looks something like this. This is again my case. I treated. This tip is provided by Woodpecker only to me, and where we have used for treatment of peri-implantitis. And you can see lot of infection and calculus deposit was there. And these are the Teflon tips which are used. The 980 nanometer, again, as we treat peri-implantitis, same way we can, as similar to periodontitis, we can treat peri-implantitis also. Another protocol which is used for treatment of peri-implantitis is pad. Again, for pad you need dyes, and pad you need different lights and machines also. So 980 we have just discussed. 980 we have just discussed is excellent for treatment of. Besides, it is a surgical laser. Mind it is a surgical laser, but for here, if I have a device of LX16 plus, I would prefer using it for peri-implantitis, for root canal disinfection, for periodontitis. So these are the three uses which I recommend people using if they have this particular devices. What about 650 nanometer? So this is a red light, and I took this again, particular screenshot from Thor company's website and market on Google. So the 650 nanometer wavelength is excellent for healing. So photo biomodulation, like I told, we will be talking more into detail later on. Comes to dentistry, there is a large body of published clinical evidence for the effect of photo biomodulation PBM therapy, previously known as low-level laser therapy, on musculoskeletal pain. Systemic review published by the Lancet BMJ International Association for the Study of Pain show that photobiomodulation improves the speed and quality of tissue repair, reduces inflammation, and has got analgesic effect. That is another aspect, and I would love to talk about that in my next webinar. Laser analgesia or laser anesthesia. So this we will be discussing in detail in the next webinar. Right now, like since I have very less time, so we will I just wanted to mention about this. The European Society for Medical Oncology suggests that using photobiomodulation to reduce the incidence of oral mucositis and also associated pain in patient receiving high dose chemotherapy or chemoradiotherapy. So where can we use? So in dentistry, this low level laser therapy or for PBM can be used in improvement of tooth movement, osseointegration of implants, post-extraction pain. We can use for paresthesia. I have got three cases which I've treated, Bell's palsy, which I've treated with low-level laser therapy, and I've got excellent result. And again, those who are interested, I can share the detail. I've used Woodpecker for one particular case of Bell's palsy. Then I can also use for TMJ disinfection. There is a patented protocol by a few companies. Also, I can use for dentin hypersensitivity. I can use for treatment of trismus, that is jaw lock, herpes simplex, bone density, for improver of bone density, trigeminal neuralgia, aphthous ulcer, tonsillitis, periodontal disease, and Bell's palsy, like I just mentioned, and osteonecrosis. So these are the certain area where we can use low-level laser therapy. And like I want also mention, I mean, it is worth mentioning here that these are alternative way of therapy. So there is no side effect if I'm using low-level laser therapy. So they are excellent. 450 nanometer. Next is the 450 nanometer. Like I've already discussed, this is the current wavelength, blue laser, and this is the wavelength which is excellent for surgery. So when we have these three lasers, I would recommend, I mean, go for, if you want to buy a device today, I would recommend go for a device which has got multiple wavelength inbuilt, so that you can do many procedure multiple procedure, you don't have to buy again and again more machines for that. Like I still have a separate device for low level laser therapy, was gifted to me one of my dentist friend long back. I've got two other lasers. They are like different wavelength, but after introducing this, I mean, this is like after introduction to Woodpecker. I can tell you, like, I don't need any other devices. This one device is sufficient for me. Some more facts I want to share just for this purpose. Just for this webinar, I went on, reviewed more than 170 article. Specifically or precisely, I reviewed 173 article, and since 2-3 days we were just me and my associates and Dr. Shelly, my wife, we were just discussing like which conclusion of this particular wavelength, what is happening, this and that. So this conclusion again, what you are seeing here was the article published by us in 2014. The diode laser is a must-have mainstream equipment for every dental clinic. This semiconductor device, having a multitude of wavelength and vast clinical application, scores over the rest in terms of its price as well as patient comfort. The time has come where we open our minds, update ourselves, learn how to use beautiful technology to our advantages, and then buy the equipment that suits our needs. This was what we stated in 2014. Now again, I'll add further. So if you have an option, and if you have an option to buy a new machine, go for a device which has got multiple wavelength in one. So this conclude my today's webinar. I'm open for question answer session. So moderator, let me know if we have any questions. I was a bit fast today, but like I wanted to discuss all the wavelength. Next is my next is the myth versus reality, where I will go on more facts about dental diode lasers. Right. So thank you very much, and thank you again for joining me. And I'm open for question answer session now. Do we have questions? Sorry. So I don't think any question is there. Uh, so thank you very much, and bye bye.